So I think the outline of today, I think, I want to talk a little bit about these 4 points, mainly why health services, why study it, what does it mean by healthcare, and what have we done so far? So just an overview of the improvements of study of health services and the science behind that, and the key concepts. Okay, so why study health services? You probably all know, you've probably got your own ideas of why you study health services, but essentially, it's really important, isn't it, to people's lives. If you ask anybody in a survey on what's the one most important thing in their life, it's probably health. It's not money, it's not success, it's health. Without health, it's really the basis to a lot of things. A lot of people's fundamental goodwill, the public think health is really important. Secondly, because of that, it's also very much in the political agenda. At least in many countries, it can win elections. Politicians talk about health a lot because of its sheer importance. I mean, it's spectrum. There are some societies who purely sort of everything is driven by health, but essentially, sometime in all of our lives, we might feel that we will come into contact with health services and healthcare, and so that's, I think, fundamentally very important. If we compare it to many other important sectors of the economy, there is so much research in health, isn't there? We've got, if you compare it to the energy sector, education sector, actually in health, we're a well-researched area because I think it just reflects the fundamental importance in people's lives. And we know that overall we're about public health and we're about improving people's population's lives. And about a third of all the advances and contributions to current health and improvements through allopathic medicine and health and the systematic efforts of health services probably contributed to a third of the improvement in population health. We still know very little and lots of uncertainty about how we define good quality and what good quality healthcare looks like and what is good and what is effective and what is efficient. We don't know about these aspects for so many of our aspects of our healthcare. We're still thinking about setting outcomes, setting standards. How should we measure it against? How do we make it better? Lots of uncertainty, and I think that's why we want to continue to study it. And also, very importantly, I think this dialogue, this discourse about the public's relationship with the health services and with actors in the health services, healthcare professionals, namely the doctor. It used to be that doctor says it all, isn't it? It's, oh, the doctor told me so. However, this dialogue is rapidly changing. We've got patients, I'm going to talk about it later on today, but patients becoming more and more informed, and they've got citizens' rights. They are consumers, and they're purchasing health as well in this day and age. And how that rhetoric has changed the accountability of our health services. We are spending. Governments are spending money, people are spending money, resources are being poured in, so we need to make it accountable. And importantly, I think the last two, it's a large employer of staff, at least in the NHS. I think at one point, it was like the third or fourth largest employer in the world. The National Health Service was second to the Indian Army or the People's Republic of China's Army, or etc., and the Indian Railway. So there are, at least in certain countries, huge employers with lots of union power, perhaps, and an industry in itself. And we talked about sustainability, climate change, and carbon it can generate. And also, not to forget the powerful medical industrial complex, the private sector that also works in dynamics with the health services. So lots of different players there, lots of different reasons. So what do we mean by health services and healthcare? I mean, this module is dedicated to it. And I think we know that in the School of Public Health, health as a wide concept, the social determinants makes it very broad. We've got health promotion, health prevention, smoking cessation activities, where we see in the community, and that's a form of healthcare as well, all the way to prevention, and then cure, where we traditionally think about the doctor in the white coat and scrubs, ER scenes, or we think about treatment, hospitals, cure, treatment, all the way to now more and more important with with the increased life expectancy, the elderly and the super elderly, into more rehabilitation and care. Rehabilitation in terms of, not necessarily curative treatments, but prolonging life, maintaining quality of life, health status, maintaining independence, and that's also a huge spectrum of activities, all the way to custody. What do we mean custody? Mental health, psychiatric services, custodial care. So huge different areas of society and coordinated efforts for health. And then it's also important to mention that the boundary is sometimes not clear cut. What do you mean by that? There are direct activities where we know very clearly these are health because they take place in a certain setting, in a hospital or in a general practice. The nurse gives an immunization, so these are very direct activities. But we know that there are also indirect activities, such as, if you take health in the broadest sense, everything, transport, housing. I'm in government, working currently in government, and we're looking at things like active transport. These all improve the health of populations, but they're indirect activities. And I think it's important for us to sort of keep the scope narrow. And so I think when we mention health services in this module on healthcare, we are talking about the direct activities. But the scope is very large, and the boundaries are not clear cut. And I think we just need to be mindful of that. When does custody, where's the boundary between a custodial sentence where you're in jail and a mental health facility where you are in a secured environment? That boundary is not clear cut, is it? There is a study somewhere that suggested that 75% of inmates, jail inmates, have a dual diagnosis of a mental health condition. So, society decides these things, but where does the line fall? So just to be mindful that it is not clear cut.